I'm no longer able to work, and I have no health insurance. Now I have a new tumor. I have no way to pay for it.
Debbie Smith is a volunteer for Mr. Obama's political operation Organizing for America. The White House invited her to attend. The president called her Exhibit A in a system that's too expensive and too complicated. One of his solutions would change the way doctors are reimbursed. Here's Wyatt Andrews.
It's the president's favorite line about what he would change first in health care.
The warped incentives.
Warped incentives, meaning that doctors get paid for every service they perform, whether it helps the patient or not.
Well, let me show you your lab results.
But on this key reform, paying doctors for quality, not quantity, the Medicare system is ahead of the president.
Like overall, the diabetes is under fairly good control.
For the last 4 years, doctors at Dartmouth Hitchcock Health in New Hampshire have been part of a Medicare experiment that pays for quality. Doctors still get paid for seeing patients, but get paid a bonus if the patients improve. They get scored on 36 areas of patient health, like controlling the blood sugar of diabetics or keeping heart patients on cholesterol drugs.
And how often are you checking your blood pressures?
To keep track, nurses call every patient as often as it takes to keep them healthy and out of the hospital.
Are you following a 2-gram sodium diet?
Special attention goes to patients who have been in the hospital to keep them from going back. So they're calling you?
Correct.
Saying, Mr. Harrington,
Correct.
time to check that
Correct.
blood sugar.
Isn't that a shocker that someone from healthcare would contact a patient?
All that contact earned Dartmouth a $6.7 million bonus payment, 80% of what Medicare saved by patients not needing expensive procedures and not returning to the hospital. Changing the Medicare payment system to reward quality seems to make perfect sense, but right now it's a work in progress. Around the country, 10 physician groups are conducting these pay-for-performance experiments, but the truth is they don't all save money every year. All 10 of the groups improved the health of their patients, but found that saving money on the elderly can take years.
This is part of the answer?
You don't know if there are tens of billions of dollars there.
Right.
But you're saying, no question, you saved the system money.
Absolutely.
So when the president calls for payment reform, almost every healthcare expert says he's right. But the amount he can save, no one knows that for certain. Wyatt Andrews, CBS News, Nashua, New Hampshire.